and thanks for joining us. I'm Laurel Hess, and this is Comcast Newsmakers, coming to you from the Detroit Regional Chamber Mackinac Policy Conference, being taped at the Grand Hotel. Our topic today is the Michigan 4x4 plan. Joining us now to talk about it is Olga Dazzo, the Director of the Michigan Department of Community Health. Thank you so much for joining us today.
Thank you.
What exactly is the Michigan 4x4 plan?
The 4x4 plan is a tool that we hope Michiganders can use to address obesity and address chronic illnesses in the state. We have about 2.5 million Michiganders who are obese and 400,000 children, and obesity is at the root cause of most chronic illnesses such as type 2 diabetes. So the 4x4 is, if you practice 4 healthy behaviors and keep track of 4 healthy measures, and if we keep the measures under control, we should be able to avoid most chronic illnesses. So the healthy behaviors are eat healthy, exercise, go and visit the doctor at least once a year, and stop smoking. So if we do those 4 healthy behaviors, then we should be able to avoid most chronic illnesses. Now, we also need to keep 4 metrics under control. So our body mass index, cholesterol level, blood sugar levels, and blood pressure. So if we keep those 4 under control, we truly should be able to control most chronic illnesses.
Now, we all know these things, right? We're supposed to eat right, exercise, see our doctor, and don't smoke, wear a seatbelt, wear your helmet when you ride a bike. We know these things, yet so many, obviously, people in Michigan across the country are not doing them because we do have such a high rate of obesity. What's in this plan to help get folks on board and keep them on track and able to actually do these healthy behaviors?
We would like to get the entire state, all Michiganders, speaking about this issue. We do have a public health crisis on our hands, so we will be doing a lot of multimedia and social media awareness about this situation. We will hope to have the healthy options available to Michiganders to make the appropriate decision making. So having more fruits and vegetables available to the entire state, having appropriate foods and beverages in schools, for example. And we hope that Michiganders adopt health as a personal core value. So we're going to have hospitals, doctors, and many individuals, restaurants, talking about this issue in the near future. So we hope to really have the entire state be very aware of this public health crisis. And we hope that individuals say, hey, it's time for me to do something for me, myself, my family, and Michigan.
Is Michigan still sort of at the top, leading the way when it comes to the percentage of obese
Yes,
residents?
we rank among the top 10 states in the country for obesity, which is, of course, not a good thing, but we hope that we have the best interests of all of us Michiganders about ourselves and about our state, and I'm confident that we will do the right thing and all of us get our health under control.
And perhaps an even more alarming statistic is not just the pure number of obese residents, is that we have so many children growing up from a young age being overweight and adopting those bad habits early on. You know, if you can stop them early, perhaps you don't end up with overweight adults.
Absolutely, and we look forward to working with the school system so that hopefully all school systems in the state could adopt appropriate physical exercise, appropriate education about the subject, and the foods, appropriate foods and beverages as well.
And don't just do it for yourself. Bug your children, your husband, your wife, everybody you know, because economically too, it's better to be healthy, not have all those huge healthcare costs, and certainly spiraling out of control. It's great for the state to be in shape. Thank you so much for joining us today.
Thank you.
Today's Comcast Newsmaker was Olga Dazzo, the Director of the Michigan Department of Community Health.